SAYWHAT has been implementing projects and interventions targeting adolescent girls and young women, particularly in ensuring that adolescent girls and young women have access to comprehensive sexual and reproductive health and rights. The Big Sister, Young Sister initiative is a project that SAYWHAT is currently working together with the United States government in order to contribute to the entire regional agenda on ensuring that HIV incidence is reduced among adolescent girls and young women.
Implementing what is known as the Big Sister Young Sister initiative, which basically is just two outcomes. The first outcome has to do with increased in-school support for vulnerable girls, for vulnerable adolescent girls and young women within schools through a strategy that we call structured mentorship. The second one has to do now with having to connect those particular adolescent girls and young women to empowerment and health services, which are not necessarily within the school premises.
SAYWHAT is also working in partnership with tertiary institutions, particularly teacher training colleges in Zimbabwe. The main objective is to ensure that student teachers also carry a comprehensive responsibility in ensuring that they have a role to play in getting girls retained within schools.
We have the mentorship classes, we have the training and induction sessions, so the Big Sisters, we have the reflection meetings, but we also have some activities that might not necessarily take place within the confines of the secondary schools, which then enables the adolescent girls to access the services outside the secondary schools. So that's where we'll also be able to mobilize people for services. We'll also be able to provide referrals to the adolescent girls.
A number of activities are underway and some have been implemented already, and these include trainings whereby Big Sisters are being trained who are going to be deployed in secondary schools where the young sisters are going to be drawn. Secondly, we've done sensitization meetings in secondary schools whereby we will be sensitizing the whole district in terms of how we are going to outline the whole program. We've also managed to do headmaster and headmistress sensitization meetings whereby all the headmistresses and headmasters have been notified and sensitized on the Big Sister Young Sister initiatives.
So through those consultative process, we came up with the 10-point plan to help adolescent girls and young women to realize their dreams. This toolkit is the major Bible that the mentors that we have been training will be using. So it's a booklet with key areas or topics that the mentors will cover when they engage in the mentorship sessions with these adolescent girls. For example, we have topics like decision making, knowing services, ICTs, and their health and relationships themselves, gender, culture, and law. And other topics that are relevant to young people.
With that, the project also hopes to achieve the broader goal of retaining the girls in schools and ensuring that they get the education that they need, and the girls are also linked into accessing comprehensive sexual and reproductive health services that they need within their communities.
These Big Sisters are then going to be deployed in the secondary schools from which the mentorship sessions are going to be conducted with the young sisters, and these are adolescents, young women who are within those secondary schools. And then more key also is the referrals that are going to be done by the Big Sisters to various service providers for the young sisters, for them to be able to access services on various issues that they would have identified.
Today. So it's a full package, and outside that we also had to ensure that we produce these other materials that the mentors will be using. For example, the mentorship guide itself, which will guide them to provide the mentorship. We have the mentors notebook, and then we also have the other key component of the toolkit, which is the referral book, where after providing the mentorship, they need to refer the adolescent girls and young women to access services. So we're seeing it. Whilst all these other topics, they will help in terms of empowerment of the girl child, for them to realize their dreams. We also need to promote their access to services. So as they provide the mentorship, they also have to identify possible cases of young women who need to be referred for services, and they'll be writing these referral slips.
beyond receiving information, beyond receiving skills, beyond having the interactions, they are also able to get the requisite services that they need. It might be HIV testing and counseling, it might be being initiated on art or any other service that they might need. It might be psychosocial support, probably after having been a victim of abuse.